And welcome to 263 Chat. Join the conversation. Today we are unpacking Zimbabwe's health system with Dr. Matara. Denishora is my name, and we welcome you all to the conversation. As we go on with our conversation, any questions, please put them in the comment section. Thank you so much. Good morning and welcome to the show, sir.
Thank you very much.
The first question is, what is the current status with regards to doctors' strike?
Well, I can say that the doctor strike seems to be semi-going. It's not a full-blown strike, as some medical doctors are attending to patients, especially in the provincial and district hospitals. They are attending to patients. The situation is somewhat different in central hospitals like Harare Hospital, Pararenyata Hospital, Mpilo, UBH, where seems to be a bit of an ongoing go slow or industrial action by doctors there. The main issue is even if doctors still want to go to work, the main issue is that the hospitals are functioning at a very low capacity. I would say less than 30%. They are only working in what we call emergency mode at the moment. So even if doctors want to go to work, the situation does not allow them to be at work full time at the moment.
Okay, so given that, what does it take for us as a nation to see our hospitals fully functioning?
Well, it's a very complicated situation that we have at the moment. The main problems that we have at the moment is that we have a health sector that has been neglected for quite a long time. I think for the past 2 decades, doctors have been going on strike, nurses going on strike, and they've been talking about the same issues every day. So we have had 2 decades where the healthcare system continued to deteriorate, and now to rebuild it, it is going to be a mammoth task for everyone. The main issues that I think should be addressed for our health system to be effective. The first one is health financing. There is no health sector that works without money being put into the health system, and we have seen that for quite a long time we have not committed and invested financially into our healthcare delivery system. You know, the Abuja Declaration that we signed and ratified as a nation states that we should commit 15% of the national budget to financing healthcare. But we have never met that standard that we set for ourselves. I think the highest that we got was 10%. So it shows that there is lack of commitment in terms of financing healthcare. And if we do not finance healthcare, we are going to be having perennial drug shortages. We are going to be having shortages of equipment being run down, and our health hospitals will not function. So we really need to have an input in terms of financing heavily into our healthcare delivery system. At the moment, about 70% of our health delivery system is donor funded by international donors, and as a nation, we only put 30%. We really need to do better and make sure that we finance our healthcare delivery system, and donors should just be a complement and not being the major players in terms of financing healthcare system. So that's the first important point in terms of health finance. Then the second point is addressing health worker situation. You know, at the moment, like the first question you're asking about strikes, we are having strikes every year. Sometimes even twice a year, we're having doctors going on strike. So we really need to address the health workforce challenges that we face. The first one is a perennial strike, and the second one is a brain drain. You know, we have our qualified doctors, specialists who are always leaving this country. So we need to establish a health service commission, because right now the health services board, which is responsible for caring about the health workforce challenges, have been failing dismally since 2005 when it was established. So we really need a health services commission similar to the judicial services commission, which is directly funded from the national budget, so that they have autonomy to decide
another technical difficulty over there, but he was talking about having a health service commission which caters and also talk about the health workers' conditions, since the one that was created in 2005 is not fully functioning and that it should be government funded. Mr. Matara is back online. Welcome you again, sir.
Okay, yeah. So we need the Health Service Commission, which is similar to the Judicial Service Commission, directly funded from the national budget, so that they have autonomy to distribute funds as they see fit. Because at the moment, even if the Health Service Board wants to increase salaries of doctors or nurses, they will need to seek treasury concurrence, and there is a lot of bureaucracy that goes on. So we think that there is a lot of bottlenecks, and that's why we have this perennial health worker strike. So that is the second major challenge that we have in our health delivery system. And the third, again, most important thing is the issue of shortage of essential drugs and medicines. You know, if you go to our public health hospitals right now, you cannot even get simple medications like hypertension medication or diabetes medication. So we again need to capacitate giant pharmaceutical companies like CAPS, NatFarm, and other pharmaceutical companies to make sure that they have the capacity to produce massively drugs which are needed locally, because right now we really depend on importing drugs, which is very expensive, but we have potential to be producing drugs as a country. So I think those are the three key areas that we need to address as a nation to make sure that our health system delivery is functioning, and our public hospitals are functioning normally. Health financing, health workforce, and also access to essential drugs and medicine.
Okay, thank you so much. And what is your view with regards to the appointment of the Vice President Chiwenga as the new Minister of Health?
Well, we really do not like to comment on appointments, and we think that we need to comment on the actions of the appointed personnel at the moment, because we don't want to talk about personality, but um, how they are doing the job at the moment. Of course, as a health professional association, and as health practitioners, the appointment came as a bit of a shock, but we are saying we need to see how the minister is performing, and we can only comment on his performance rather than on the appointment.
Okay. How inclusive was the ministry in creating the restructuring strategy?
Sorry, I didn't quite hear you.
How inclusive was the ministry with doctors, engaging with doctors and nurses in creating the restructuring strategy that has been
Well,
implemented by the ministry?
okay, yeah, I think restructuring, if you read about restructuring a health system, it's a very, very complicated process, which is very delicate, and it should include massive consultations. It's not only consultations of doctors and nurses or pharmacists and other healthcare professionals, but it should be consultations with even the end user, the people on the ground who uses these public health hospitals. They should be consulted as well. Private players, they should be consulted. Those who finance our health delivery system, they should be consulted as well. And other stakeholders, including donors, including civil society organizations and other community-based organizations are working within the health sector. All those people, they should be consulted. We feel that the restructuring process did not include all those consultations. I think it was a group of people, individuals who are there up there in the ministry level and other top officials who sat down and come up with a plan. So it was sort of a top-down approach, which is not very inclusive, and we feel that it could have missed some very serious concerns from people like the end users at the ground, who would have some challenges which might have been factored in the restructuring process. And we feel that the outcome of the restructuring process is not very inclusive of everyone. There should have been much more consultations. I'm sure they had consultations up there in the ministry, but I think it was a bit of a small group of people and did not include a wide range of stakeholders.
Yeah, we're following up. We've got a question from the comment section. Ms. Pat says, how did they come to the charge of $70 for COVID-19 tests before a person is seen by a consultant?
The charge of COVID-19 of $75.
70. How did
Or
they come
$70.
to?
Yeah, that's the challenge, because if you see the people who are charging COVID-19 tests, the PCR tests, most of them, in fact, all of them, they are private laboratories, and it's very difficult to regularize or regulate, to regulate the prices of private players in the healthcare system. So we cannot tell private players to say you need to charge that much, this much. This should be the responsibility of our public hospitals, so that, because the private players, it's for people who can afford to go there. We need to have an alternative where those who cannot afford can access the same services, which should be provided by the public hospitals. So we need a situation where Paranyata Hospital, Salim Gabi Hospital, Mpilo, UBH, provincial hospitals need to be doing these tests so that the poor can access the services. So it's a matter of the government not taking its part in terms of providing these services, and then it leaves rooms for private players who are after profit to take advantage and charge those amounts. And there's nothing that we can do to them because they are in the private. It's not their role. Their main role to be providing services at very cheap prices, because they are after profit. The government, which is a non-profit organization, is the one which is supposed to be providing these services at a cheaper price for the majority of the public.
So as it stands, are patients being tested for COVID-19 in the public hospitals?
It's a challenge in public hospitals. If you have seen on social media, people are continuing to post that we go to a public hospital and our relatives or friends are turned down to say you cannot be admitted with a COVID-19 test. So especially in emergency situations, you cannot. It's very difficult to access a PCR test in public hospitals at the moment, and people are being sent out to private hospitals and private laboratories. And like you said, the cost is out of reach for the majority of Zimbabweans. So it's a hassle to get the test. The tests that are being done are the ones which are being done on people who are stable, and the numbers are low. If you look at the numbers that we are receiving from the updates from the ministry every day, the numbers is quite low. We know that testing is a challenge even in developing countries like the USA. They are still having challenges in terms of accessing, but we feel that ours is way low, and we need to improve and do better on that.
Okay, follow-up question on the comment section again. Needs a Party is asking, how much is public hospitals charging for COVID-19 tests, and are they available?
For COVID-19, what?
Needs a Party is asking, how much is the public hospitals charging for COVID-19 tests?
Well, in public hospital, the government has made it clear that treatment for COVID-19 is free. So for the testing, the admission, the treatment for COVID-19, it's free in public hospitals according to the government regulation. So I don't think the government is charging anything for the treatment of COVID-19. It's absolutely free, but access to that services is the one which is very limited at the moment, because the access to the testing is limited. Even the access to admission, it's very limited. At Paranato Hospital, they've built a very good isolation unit for COVID-19, but because of the health worker challenges that we are facing, that unit is not being fully utilized at the moment. So some people might end up not getting the services because of these challenges. But if you do get lucky to access the services, it's absolutely free.
Okay, you mentioned health worker challenges. There are reports that doctors are receiving threats to report back to work. What's your comment on that?
Yes, Denise, I don't know what's happening with the mic. I can barely hear you now.
Okay, can you hear me now?
It's very, very faint.
And now, can you hear me?
Yeah, just try. Let me try to hear what you're saying.
Okay, you stated and you commented that there is a health worker challenges that is facing the health sector. There are reports that doctors and nurses are receiving threats to report back to work. What's your comment on that?
Yeah, I'm sure the nurses. I saw the nurses association um, giving a directive to their members that they need to go back to work. But it's something which is, I think, which is a futile exercise if people are being forced to go back to work when the challenges that they raised in the first place are not addressed. We saw that with the doctors last year when they were on strike for 5 months. They were forced to go back to work and their challenges were not addressed. They only go back to work and work for like 3, 4 months and then they are back on strike again. So even if people are told to go back to work when the fundamental challenges are not addressed, I don't see that as a long lasting solution. We will continue to have a perennial strike. They might go back to work, but after 2, 3 months, you might find out that they will go back again on strike. So we need to deal with these issues once and for all, rather than to give piecemeal solutions to a crisis that has been going on for quite a long time like this.
Okay, thank you so much, Dr. Matara. We are still in a conversation with Dr. Matara, and viewers, feel free and you are kindly asked to put questions in the comment section so that we have a conversation as we continue talking to Mr. Matara. Recently, the minister has banned international referrals for patients. Is this more viable looking at the state of our health sector's infrastructure?
Well, when we heard that they started international hospitals, at first we thought that they were just saying that they are not
Then,
going to be financing government officials from accessing healthcare outside the country. To us, that was something which is very positive because we need people to access the healthcare delivery system in the country because that's the only way they are going to improve our health delivery system. But reading further on, it seems that the ban was on everyone else. So it seems unfair at the moment that we have a health delivery system that is not working at the moment, and we ban people from accessing healthcare services outside the country. I think what we need to do at the moment is to make sure that our hospitals,
sorry to interject you.
you know,
Can you please increase your volume?
okay, yes,
Can you please increase your volume?
just banning people from getting services outside. We need to make sure that our hospitals are functioning normally. I don't think someone would opt to go and get treatment in India or South Africa when they can get that same service at Pararingakwa Hospital. The only reason why people were going outside is because they could not access the services in Zimbabwe. So it's not just a matter of putting a law banning the traveling of people, but we need to make sure that those same services are available in the country. If they are available, I don't see a reason why people would choose to go outside rather than access the same services in this country.
Okay, thank you so much. Another follow-up question is, yeah, Mizipate is saying, ever since we saw the dead newly born kids, has the maternity section improved yet?
Yeah, that is a very important question. Thank you very much. We are still having a challenges in the maternity section, as, as we are seeing challenges in all other health sector sections as well. So there is a very big improvement in terms of maternal and child health care at the moment. Pregnant women are still failing to access health care, and the closure of outpatient clinics at the moment, it means that even pregnancies are not being monitored as we would want them to be monitored. So it's something which is still very delicate, and people are still finding it a challenge to access maternal services. And also from the restructuring process that was done, we also think that those important sectors which should have not been merged into just curative services, but sectors like maternal and child health care, epidemiology, and disease control. There should be sectors that should be standalone with their directors, like it was in the previous structure of the ministry, because they are very important. And yeah, like I said before, we still have a challenge in terms of maternity. Nothing has been done to try and rectify the challenges that we faced when we saw that babies continue to die because of lack of proper monitoring. We still maybe it might improve in the next week if the nurses are back at work at full scale. But for the moment, things are still not right in the maternal field.
Okay, thank you so much. Given that the Ministry of Education has announced that children are going back to school, what is the state of what is the state of preparedness with regards to fighting COVID-19 as other stakeholders are opening their doors?
You said opening of what schools?
With regards to the Ministry of Education, they have stated that schools are reopening. That's another stakeholder opening, right?
Yes.
So our question is, what is the state preparedness in fighting COVID-19?
All right. Thanks. Yeah. Unfortunately, I haven't heard anything in terms of how are they going to prepare the schools in terms of infection and prevention control. So I'm not very in a very good position to comment on that, because I'm not quite aware if there are any measures that have been put place in schools to make sure that we do not have infections spreading within the schools.
Okay, thank you so much on that. Also, a follow-up question, do doctors have enough personal protective equipment as
Well,
frontliners?
the issue of personal protective equipment is something which is a challenge, not only in Zimbabwe, even worldwide. There is a global shortage of personal protective equipment, and worse so in this country where there isn't much financing of healthcare sector. So there isn't much in terms of PPE. I know for a fact that this last week at a provincial hospital, people could not access even gloves. I have a colleague of mine who was at work and there was no gloves even in casualty. So even before we talk of even complicated or other more expensive personal protective equipment like the hazmat suits and things like that. Even things like gloves and face masks are still a challenge in our hospitals. So there is a very big challenge in terms of that.
Thank you so much, Mr. Matara. We were engaging with Mr. Matara on the Zimbabwe's healthcare system, and he has reiterated that workers' concerns have not fully been solved. And also, we are looking at Zimbabwe not having enough personal protective equipment. Denishura is my name, and thank you so much, viewers, for getting engaged in the comment section. And please don't forget to like our Facebook page, 263 Chart, and also our Instagram, and also by visiting our website www.263chart.com and subscribe to our channel YouTube channel 263 Chart. Thank you so much, Mr. Matara, for engaging with us.
Thank you very much, Denise, for the opportunity, and thank you, viewers.
Thank you so much. That was all for today's conversation.